the concern people have is, well, but I'm worried about dementia. If I start a statin medication, I've heard that can cause dementia. My understanding of our 40 years of data that we have on statins is that there's less dementia in people, again, post hoc analysis, but, less dementia. But what if somebody, I don't know if your patients come to you, but if somebody says, look, I'm worried about this statin medication in regards to my risk for dementia, what's your advice for them?
Yeah, it's been a confusing story, and there was some thought based on some epidemiologic data that maybe statins higher raise the risk for dementia. There was some back and forth. There are old studies looking at statins to treat dementia, but I think the preponderance of evidence now is that no, statins are not going to increase your risk of dementia, and that if anything, it's looking more and more that LDL and other and dyslipidemia in general is a risk factor for dementia. So certainly if it were me or my family member, which I always go back to, and the LDL was elevated and a statin was indicated, I would not hesitate to take it. And I think, to your point, there was, there's lipids are in the brain and maybe it's inhibiting the lipid production and that's having some harmful effect was kind of the hypothesis. But that's largely been shown not to have been the case. And you have a lot of confusing things when you look at people on statins because they have all these other conditions, right? And so then maybe they have diabetes, maybe they have high blood pressure, maybe they're not living a healthy lifestyle, and maybe those were the things, not the statin necessarily, that were increasing risk of dementia. Now, people always, scientists, epidemiologists always try to control for those factors, but it's impossible to do that perfectly. Bias gets introduced. So the bottom line is that, no, I don't think statins increase the risk of dementia. If anything, lowering LDL is likely to be beneficial.